Hi guys, SCA candidates. So if you're preparing for the SCA, which is the simulated consultation assessment, I think I saw a place where they called it structured consultation assessments. I'm not sure if there is a change in name or if there is if they're considering changing the name to a structured consultation assessment. Whatever it is, it's a final RCGP examination assessment which you as an SC3GP trainee has to pass in order to emerge as a qualified general practitioner, primary physician within the UK. And then with that certificate, you can choose to practice as a GP within the UK or in some other countries like New Zealand, Australia, Canada, and some states within the United States as well. So a couple of things I just want to reiterate or just emphasize actually in this SC exam based on my own experience is your language matters. And what do I mean by language? How you pronounce words can make a difference. I remember with my supervisor during one of my clinical case reviews or my case discussions with my supervisor, I once pronounced the word famine as famine. So the stress you place on words can make a huge difference. And I noticed from my supervisor's facial expression that he struggled to understand what I meant. There was no famine in the UK, not that we are aware of. No famine, which is shortage of food supply, But I meant farming, the verb of farm. So the farming. And it also happened to me in the exam as well. I noticed that the simulator, the actor, was acting as a patient, struggled to understand what I meant because I used the word famine when I meant farming. So I had to find myself running around the bush, beating about the bush, trying to explain exactly what I meant. So the word farming, which has a stress on it, if you look at the phonetic transcription, famine, which is a shortage or absence, severe shortage of food supply, has no stress on it, famine. Remember that diagnosis is now part of domain 1. So diagnosis is now grouped with data gathering, which is different from what it was in the RCA. So the RCA, from what I gather, diagnosis was merged with clinical management. Whereas in the SCA, which is a new exam, diagnosis has been merged with data gathering. Why should you bear this in mind? This is going to affect how the exam is scored. What it then tells you is, in your data gathering, you don't need to explore every detail. You don't need to go to town. You don't need to spend your whole time on data gathering. The fact that you can get a focused history, just a few questions, that will help you clinch your diagnosis. And then you tell the patient your diagnosis or what you think is likely going on, and check if it's something they are familiar with. I suspect you might be having, whatever, is it something you're familiar with? Is it something you've heard about before? So, yeah, how much do you know about this? And then you fill in the gap. And you're explaining why you make that diagnosis. I suspect it's likely this because you mentioned you're having this, and these are symptoms we typically see in people who have this condition. So that, together with the few relevant questions you've elicited, also while making reference to the information you've already been provided with in the case history that you have to read before and even during your consultation. So you're telling the patient things like, from your notes, I can see that you don't smoke. Is that still the case? They say, oh yes, yeah, I've never smoked. So you're making reference to those important information already provided. I can see you saw my colleague a week ago. It's provided there, so you can reference it. I can see you acknowledge. I can see you saw my colleague a week ago. I can see you saw the consultant, the consultant orthopedic surgeon a month ago, and they agreed on this. Is this something you're familiar with, or you're aware of this, decision? Or patient say, oh yeah, I was told this. So you're making references. You're making use of the information. All of that comes together to support your data gathering, and of course your diagnosis. So that's domain 1. You also make use of that information already provided in addition to the extra information you've gathered in your management. I just said I should give you some of these tips, share some of my experiences in the SCA, because I believe most of them would be very beneficial to whoever is preparing to sit the examination in subsequent months. Cheers. Wish you all the best.